ahead and get started. Welcome to our first multidisciplinary approaches to ending homelessness webinar. My apologies. I had a big lunch meal right before this, so I'm stumbling with my words. I'm going to try this again, and it'll give people some time. But thank you again for joining us for our first webinar series on that will feature different service providers who carry out direct programs and services to help aid the work that you are all doing to end homelessness in Riverside County. The Housing, Homelessness Prevention, and Workforce Solutions Department, which you will hear us quite frequently refer to as HHPWS. I realize that is going to take some time to resonate, but we're going to get there because quite often I know we all say DPSS without hesitation. We also use acronyms for our County Behavioral Health Department as BH. So I believe in each of you that in a matter of weeks, in a matter of months, we're all going to be chanting HHPWS together. So in all seriousness, our department welcomes you, specifically our Continuum of Care Division, who has put this webinar series together with you in mind. Just to tell you a little bit about our division, we administer about $20 million in both state and federal funding that is used to coordinate and directly support efforts to end homelessness. A lot of that money is certainly used to support direct services. So we fund a lot of public, private, nonprofit agencies who carry out direct outreach, homeless prevention, rental assistance, emergency shelter services. But we also have some planning dollars that allow us to work jointly with stakeholders to help coordinate the delivery of those services and plan for those services. So we take this charge seriously, and as you are going to hear us say time and time again, we specifically coordinated this webinar series with you in mind. Why? Because we know that there are so many different programs that are out there with so many different start and end dates. And as a housing navigator, as a case manager, as an outreach worker, as a person that works in an emergency shelter, you are connected to individuals and families who are meeting with you and telling you their specific needs, and we want to help you facilitate those connections so that they are truly warm referrals and they reduce the response of, well, let me contact this 1-800 number to be referred. You know that client best, you know what their needs are. So what a great opportunity to learn more about those specific projects that you can help connect them to. So again, we thought of you. We're looking at this from your lens and know that we are planning on holding these every single month. And while we have speakers already scheduled for September, we are hoping to secure speakers for both our October and November series. October will focus on ending family homelessness. So if you provide any services to target that population, we'd love to hear from you. For December, we're looking at highlighting youth homelessness. So if you're a youth provider, you're doing work to support transitional age youth, we'd love to feature you. The other piece that I will say before we start jumping in here is that we recognize we have some good local experts here that do this work day to day and have done it for quite some time. So we want to hear from you. We want to learn from you what has worked and what hasn't worked. So please send us an email at coc@rivco.org. Our email's there on the slide in front of you if you are interested in speaking. Today's webinar will be recorded, so know that if you really like what you hear and you want to share it with somebody else, you will have the ability to do that. Our agenda today, from 11 to 11:35, you're hearing me speak, doing a quick welcome. Want to give major kudos to Tiffany Nelson, who is on the line and is coordinating the slides. So she is unable to speak, but has worked intensely the last few weeks to get this out to you guys and coordinate with each of our speakers. We are going to start off by hearing from Leslie Trainer, who is the director of our County Workforce Development Department, a division under HHPWS. And then we will hear from Alita Taruno, who is the WIPA project director. WIPA stands for Work Incentives Planning and Assistance. We want to encourage you that as the speakers are presenting, that you use the chat box to ask your questions. And so we are going, or the speakers are going to do their best to refer or look to those questions as they are talking. But whatever they don't get to, we did reserve 10 minutes at the end to review those questions. So I'll go ahead and read those questions out loud and direct them to the correct speaker. So with that said, we can jump over to the next slide. And we'll go ahead and do a handoff to my good friend, Leslie Trainer, again, Director of Workforce Development Center, who will begin to talk about all the great work that they are doing to help connect people, including the people that you serve who are experiencing homelessness, to workforce services. Here you go, Leslie.
Thank you, Tanya. And I want to thank you for the promotion also, because I am actually the Deputy Director of Workforce Development, and you have unofficially promoted me to Director. So I'll go ahead and call our bosses after this and see if there's a change in my pay commensurate with that promotion. But anyway, as Tanya said, my name is Leslie Trainer. I am the Deputy Director of Workforce Development, which is a sister division within the HHPWS department. And Stephanie Adams was supposed to be co-presenting with me today. She is the Regional Operations Manager for the western part of the county for Workforce Development. She has texted to let us know that she has gotten stuck in her prior Zoom meeting as a virtual traffic accident, as it were. So I will look out and see if she joins us. If not, then I will be presenting, and unfortunately for all of you, you'll just have to look at me and listen to me this whole time. But we wanted to provide an overview of the services we provide at Workforce Development. We have an inside joke that we are the best kept secret in the county. We do not want to be the best kept secret in the county. So we want to share with you some information about what we do in general and what's on our radar with helping individuals who are homeless or in danger of becoming homeless specifically. Next slide, please. So this is a picture of our Riverside career resource area. And we actually have 3 workforce development centers, or AJCCs. Those are America's Job Centers of California. As Tanya said, we love our acronyms in the government world. But essentially, workforce development centers, or AJCCs, are designed to be one-stop locations where somebody could come and have many of their employment and workforce related needs taken care of. So those career resource areas or workforce development centers are located in Riverside, Indio, and Hemet. We have currently an access point in Moreno Valley and also in Blythe. And at these workforce development centers, a person could come in without an appointment when things get back to normal. BC, before COVID, people could come in without an appointment. AD, after disease, we're taking folks by appointment to come into our centers. But we have these computers that you see in the picture, And folks can use them to create their resumes, to apply for jobs, to register on Cal Jobs, to communicate with employers, things of that nature. And there's always staff that are inside these career resource areas that wander around and help. A lot of times the people that come in to use the computers, they maybe don't have computers at home or internet, and maybe they're not polished in how to use computers or how to navigate a Word document. So we always have folks in the career resource areas that are available to provide assistance. Next slide, please. So at workforce development in general, we think of the workforce development system as an ecosystem, and there are two major entities in this ecosystem. There are the workers and there are the employers. And in order for this whole ecosystem to function optimally, we have to have both of those entities in good shape. We want to make sure that on the worker side, the workforce is skilled and ready, and on the employer side, that those employers are strong and resilient. And so we have services that target both elements of that ecosystem, the workers and the employers. So I gave you some information already about what services people can receive when they come into a career resource area, including the computers. We have copiers. We have, I believe, a fax machine. There are really only two government agencies that I know of that still use faxes. It's the IRS and the State Employment Development Department. So we have the ability for folks to access that equipment. And we have kiosks with flyers for job fairs and job position openings, things of that nature. And those are available for anybody to use, free of charge. There's no income limit for those services. We also have individualized or one-on-one services for those who do qualify under our major federal funding source, which is the Workforce Innovation Opportunity Act, or WIOA. Again, we're back to our acronym. So WIOA is our major funding source. For folks to qualify for that, they generally need to be either currently unemployed or low income. So the career resource area we went over, staff on site. We have career coaches who are here and available. AD, after disease, we've started providing these services virtually, so our career coaches can help people by phone. We've gotten everybody cameras for their computers, so we do virtual meetings. And we're working on different types of things via a video. We're installing virtual studios in all of our centers. But the career coaches essentially provide that one-on-one assistance and guidance and direction that individuals sometimes need to figure out where they're at right now, where they want to be, and create a plan for bridging that gap. At our sites, we also hold job fairs. As a matter of fact, you might be surprised to find out we had a mini job fair today. Even with the pandemic and the record high unemployment rates, there are still businesses that are hiring, and they like to use our centers to conduct interviews, to have us screen applicants, or just to have folks come in and get information. When we do give individualized services for those individuals who qualify for WIOA, we really just do everything we can to make sure those individuals are prepared to go into a well-paying job, a family-sustaining waged job. And to do that, different people need different types of help. Sometimes a person will just need help sprucing up their resume. Sometimes there's interview assistance that's needed. I think even for those of us who have been in business for a long time, interviewing is really intimidating. And so sometimes mock interviews will help you brush up on your interviewing skills. We can do that. We help with job placement. One of the things we're really well known for is vocational training. At workforce development, we don't actually train individuals for vocational purposes, but we contract out to training providers that have been vetted and on a state list. They're eligible training providers, and we can subsidize that vocational training for up to $8,000 per person. And then we provide referrals to our friends and partners, many of whom are listening right now. So if somebody comes to us and says, I'm having trouble making my rent payment, we can refer them to Tanya's special programs team for assistance with that. We can refer them to DPSS to get on to CalWorks if they're not already on that. We can refer them to Veteran Services. We also have lots of partners on site that we can refer to. We have Goodwill that's on site here in our Riverside office. The State Employment Development Department is on site in Riverside, Indio, and Hemet. Although I should add that the State Employment Development Department has many different divisions within it. Unemployment insurance is one of those divisions. Right now, unemployment insurance is only located in Sacramento. So the EDD partners we have located locally in Riverside County are Employment Development Department employees, but they offer different types of services. They don't handle unemployment insurance, but they have lots of cool programs. For example, they have a farm worker assistance program that's designed specifically to help farm workers get jobs and provide support to them. They have veteran services representatives who are dedicated to helping veterans get jobs. And they have a program that provides stipends to individuals who lose their job because their job was outsourced overseas. So, combined with our partners, we have a lot of cool tools in our bag of tricks to help individuals who are they're maybe unemployed right now, or they're underemployed. They're working 2 or 3 jobs to pull together the type of money they need to float their household bills. So that's the worker side. On the employer side, again, we want to make sure that the employers are strong so that they can have those good family sustaining wage paying jobs. And so for employers, we can help them screen resumes and applications. We can hold job fairs, which we do quite frequently at our centers. We can provide general HR guidance and assistance. Riverside County has a lot of small employers, many of whom do not have their own human resources department. So we can assist them with information about common human resource problems. We can connect them with our partners who will provide capital resources, grants, and loans for businesses. We also provide on-the-job training, which is a program that I'm going to mention when I start talking about homeless services for homeless individuals. On-the-job training provides an employer reimbursement to up to 50% of the wages of a new employee while the employer trains those individuals. And for many employers, it's just a great incentive. It helps with their cash flow. But when we get to populations where there is a perceived risk or a stigma associated with bringing those employees on, this program can act as an incentive to mitigate some of that risk. And I'm also seeing now, I'm just looking at catching a latest comment in the chat box. She's asking, what is the income threshold for low income? What I would recommend is that we send that income limit chart to maybe Tanya and Tiffany, and could you email that out to the group, ladies? Okay, cool. So we will get the income limits sent out for that somebody would need to meet to qualify for WIOA services. Okay, so that's a general overview of workforce development services, and I wanted to talk more specifically about homeless assistance for individuals who are homeless. And Tanya, how am I doing on time? How much more time do I have?
You have about 1 minute, but let's give you a few additional minutes to wrap that up, because that's important.
Next slide, please. So homeless services, both Stephanie and I come from the housing world. So I just want to make clear that providing workforce assistance to individuals grappling with homelessness is very dear. It holds a very special place in our hearts, and is something that we are both really excited about and taking on here at Workforce Development. So in the research that we've done for workforce interventions for individuals suffering from homelessness, it's very, very clear that the most successful workforce interventions have a few key ingredients, one of which is involving an interdisciplinary team, which makes this presentation perfect for this phone call. That interdisciplinary team can provide wraparound services and really look at that individual as a whole person. The workforce issue is just one component of that whole person and all the multitude of issues that they may be grappling with. Second thing is the presence of benefits counseling and/or a benefits counselor on that team. And Aleda is going to provide information, lots of really good information about benefits counseling right after I'm done talking. And then the idea that this is not a short-term thing. It's a long-term relationship that we would have with that individual. Once we help them get a job, that's just step one. Step two is helping them succeed in that job and then moving up to different levels in their career trajectory. A fourth thing that we found to be very interesting is that the most successful workforce interventions involve taking an individual who is homeless, and instead of putting them through a lengthy training period, a vocational training period, the best outcomes come from putting that individual into employment right away, immediately. And when you think about the psychological outcomes of employment, where you are feeling self-confident, you are seeing that you are earning income, and that blossoms as time goes on and would have a trickle-down effect on maybe different issues that that person is contending with. So putting somebody to work right away instead of making them go through a lengthy vocational training process first. And then the final element that seems to be required for success in workforce interventions for homeless individuals is having the opportunity for transitional employment. So even though an individual might be going to work right away, they may not be a good fit for full-time permanent employment. In other words, what may work best for that individual is part-time transitional employment that's designed to get them in the door, reacquaint them with being in the workforce, and then giving them time the rest of their day and the rest of their week to have behavioral health services or talk with their housing counselor to become used to living in a home rather than on the streets. So all those things are recipes for success for workforce interventions for homeless individuals. And quite frankly, Stephanie and I spend a lot of time looking at the ways that our current funding source, WIOA, is not really designed to address those needs. WIOA is designed for full-time permanent employment as opposed to transitional part-time employment. And with WIOA, we're really only tracking folks for a 12-month period. And most individuals who are homeless are not going to fit neatly into that 12-month box. They may not have everything figured out and ironed out within a 12-month period. And so we are actively looking for ways that we can either take our existing funding source and make it work for this population, or we're going to have to go out and find other funding sources that allow us to meet the needs of that particular population. Do just really quickly want to add that we have 2 pilot projects going. We started them BC before COVID, and of course COVID hit and everything just went poof. And so we're trying to figure out how to after we are done prioritizing the response to COVID, how to pick back up on those 2 pilot projects for workforce interventions for homeless individuals. So with that, just know that we have a lot of great tools available at Workforce Development. Stephanie and I are available for questions. We will be providing the income limits. I see there's another question here about what incentives are available for employers who are willing to provide employment for formerly justice-involved individuals. another population where there might be a perceived risk to employers for taking those on. For those employers, I would also, again, recommend on-the-job training. We are working with the state right now to request higher reimbursement rates. Right now, we're reimbursing the employers 50% of the employees' wages for on-the-job training. For more barriered populations, like individuals who are homeless or justice involved, we think that it would be incredibly beneficial and a huge incentive for employers to take on those types of employees if we can reimburse for a higher percentage. So we're working on that right now. So understanding that, my time limit has come. My time has come. My email address is included in the PowerPoint. I'll just type it into the chat so everybody has it. Feel free to reach out to me and Stephanie, and we're really happy to work with you and look for solutions to help these populations that really need our help. So with that, Tanya, I'll hand it back to you, and thank you so much for your time.
Great presentation. Thank you, Leslie, Stephanie, and others on your team who are helping us move the needle and end homelessness. Moving on to the next slide, so excited to introduce our next speaker, and I have to give kudos to Leslie Trainer, who actually helped me facilitate the connection, to Alita Taruno, who, hopefully I'm getting the job title right, is the project director with WIPA. Again, just to kind of quickly share and confirm that we are keeping you in mind, there was a case manager who was providing direct services to people who were formerly homeless and then linked to housing, and a large portion of that population was disabled. And part of the program's goals, or a goal of the program, included, trying to help increase whether it's access to benefits or income. And so the question came up of, can people who receive disability benefits work without impacting their benefits? And it was kind of this, question that was out there, and provider to provider, we were getting some mixed responses. So we went to the pro, Alita Taruno, who is going to be sharing on this topic. So if you're working with people who are living with a disability, you are going to love this next presentation. So Alita, I'll go ahead and hand it over to you. Thank you.
Great. Thank you so much. Thank you for inviting me to this presentation. I'm really happy to be here. If you can go to the next slide, we'll get started right away. This presentation is really not to teach you about everything about the work rules, but to just give you some language and understanding of what your clients might be telling you. A lot of people will come to you and say, well, I heard I'm going to lose my benefits. I heard I'm going to lose my health care. And that's not necessarily the case. So you're going to have a resource at the end of this to be able to get concrete information for your clients and a place to refer them to for some concrete information. So let's go to the next slide. All right, so I like to work with images. Sometimes I think they're helpful. And so here is my Social Security octopus. And when I talk about the work rules, you really have to separate out these benefits. Believe it or not, there's other benefits that Social Security Administration administers, are very rare. These are the ones that we're talking about in terms of disability, Title II and SSI. Title II consists of Social Security disability insurance, disabled adult child benefits, disabled widow benefits, and then SSI is also referred to as Title 16. And of course, there's also retirement benefits. We won't be talking about retirement benefits. There are no earning limits for those who have reached their official retirement age. And if you want more information about that, there is a lot of great information about retirement benefits on the Social Security website. All right, next slide. Okay, so Title II, where does Title II money come from? So we're going to start talking about Title II. Social Security disability provides a cash benefit to disabled or blind individuals who are insured by workers' contributions to the Social Security Trust Fund. These contributions you will see on a paycheck as FICA. And as you can see in this picture, there's money going in and eventually money coming out so that this benefit is available to people who work. There are no resource limits for this program. You can own a yacht, a house, 3 sports cars, and that will not impact your eligibility or entitlement to this program. So you have to remember that for this program, it's really important that it's very different from SSI, which we'll talk about later. Next slide, please. So to receive benefits under Title II, you need to have a disabled worker to qualify for these benefits. However, it is possible to receive benefits based on a worker's entitlement to benefits. So a good example of this is a person who is a minor who qualifies for benefits based on a parent's benefit, and then they become eligible because they are an adult with a childhood disability. So this is, if you're familiar with regional center clients, I have a lot of regional center clients who are eligible for these benefits because they have a parent who's deceased, disabled, or retired and receives Social Security benefits as an adult with a childhood disability. So part of my job is to understand the benefits that someone is on, to verify these benefits. That's the first step in really giving benefits counseling, is understanding a person's benefits package, including what cash benefit they receive. Next slide. So anybody on these benefits, Social Security Disability Insurance benefits, Title II benefits, will receive Medicare benefits at some point. There is normally a 24-month waiting period. And this is really important for folks because if they're not working, they may not have health care, and Medicare may be their only option in some cases. Next slide. So we're going to talk about briefly, again, this is just to give you a broad overview of what happens if someone is on Social Security disability and they work. Next slide, please. All right, so I'm going to introduce you to some terms, and these are broad terms. And the first one is the trial work period. So someone who is on Title II benefits has normally a trial work period. The trial work period allows a person to test their ability to work for at least 9 months. And during the trial work period, a person will receive full SSDI benefits, regardless of how high their earnings might be. And the trial work period continues until the person accumulates 9, and they don't have to necessarily be consecutive. And in this year, in 2020, a trial work period month is used when a person earns over 910. And so part of my job is to figure out, does this person have any trial work periods to use? Have they used any in the past? And will they be using their trial work periods? And what does that mean for that person? All right. Immediately following the 9th trial work period is a 3-year period called the extended period of eligibility. Benefits can continue for months. The person has earnings below substantial gainful activity. Cash benefits can be suspended for months the earnings are over that SGA level. And if earnings fall below the SGA level during the 3-year period, benefits can restart again without a new application. So the $1 million question is, what is SGA? Next slide, please. So substantial gainful activity is the performance of significant and productive physical or mental work for pay or profit. And it's not just a number. As what happens is that Social Security will look at a lot of facts to make a decision about whether the person's work activity is truly SGA. So in terms of numbers, if a person is earning over the SGA, that means they're earning over 1,260 this year. But there's a lot of facts that Social Security will consider before they determine that even though they have gone over this SGA amount, they're going to consider some facts. Let's look at the next slide. So what facts does Social Security consider to make an SGA decision? Next slide, please. So one of the things they're going to look at is impairment-related work expenses, or IRWEs. And IRWEs are certain expenses for things that a person needs because of their impairment in order to work. And those expenses may be deducted when counting earnings to determine if the person is truly working at the SGA level. So one example there, well, the next slide has some examples of these. So it could include if a person's paying for attendant care services, for any kind of drugs or medical services, transportation. I had a client who was blind, and in order to get to work, from home to work and so forth, she had to use Uber. She didn't really have a choice, so we got her those transportation expenses approved as IRWIs. Service animal expenses, and it would include all those costs. So when I work with a client, I'm asking a lot of questions because it's possible that even if their work activity is over the SGA, it's possible that these expenses that they might have will bring them down to below that SGA level. And it's helping that person understand how to collect information and eventually report this information to Social Security. Okay, so let me see. I'm going to just look at this question. It's really long, but maybe I'll hold off after we finish talking about Title II. The other thing that Social Security is going to look at is whether a subsidy or special condition exists. This is a little complicated. I'm going to summarize it. Like I said, it's a little complicated. A subsidy happens when an employer provides extra accommodations, supervision, or special assistance because of the beneficiary's disability. So I had a client who was working at Kmart and was hired under a special relationship with the family and was provided extra supervision. Long story short, the supervisor was able to attest that there was extra help, and he assigned a 20% subsidy. So what that meant for my client was that 20% of his earnings were not going to be counted to determine if his work activity was truly SGA. And in his case, it wasn't, and so his benefits continued even after the trial work period. A special condition exists when a worker receives support or services from someone other than the employer. So that could be job coaching services either through Voc Rehab or the regional center. Okay, next slide. So what happens to Medicare? So people are still able to keep Medicare despite not being able to receive a cash benefit if they're truly working over SGA. Is there more information? There should be more information on that slide, but I don't see it. So there you go. If cash benefits continue, Medicare eligibility continues. If cash benefits pause, Medicare can actually continue for up to 93 months following the trial work period, or up to 78 months if benefits truly terminate. When I'm working with the client, we are making sure that they understand what will happen so that there are no surprises. If cash benefits are going to end, they're going to know that. They're going to know when they will be able to get back on benefits if that's what truly happens, that their benefits pause. What's going to happen with Medicare when they are working over that SGA, or if their benefits will truly terminate, what will happen to Medicare? All right. All right. So let me take some questions here because we're going to switch over to the SSI. Again, this is a really broad overview to to Title II. I guess someone was. Let me see. I don't see any questions.
I think you're good,
Okay.
Alida.
Yeah. Okay. All right. So let's go to, now that you've learned about Title II, we're going to change gears completely and talk about SSI, which is probably the benefit that most people are familiar with. So let's go to slide 25. So SSI is a cash assistance program for people who are aged, blind, and disabled, including children under the age of 18 and who have limited income and resources. So SSI is a means-based program. So it provides a minimum amount of assistance to pay for food and shelter. To qualify, a person must meet certain resource requirements. For example, they can own a house so long as they live in it. They can own a car, or one car, and they cannot have more than $2,000 in resource, so money in the bank. The amount a person receives depends on many facts, including do they pay their own rent? Do they pay for their own food? Do they get help to pay for rent or food? Do they live in a boarding care, or do they have cooking facilities? So we didn't hear those resource requirements for Title II, but for SSI, we do have those resource requirements. Next slide. Okay, so here is the federal and state amount for SSI. So in California, this is an example. If you are an individual that lives in your own apartment, or maybe you live in a roommate situation where you split the rent and utilities 50-50, or you live with maybe a parent and you pay your fair market value for your room and food, then the likely rate you will have is a $943.72 in 2020. Again, there's different rates depending on facts, but we're going to use this rate as an example in the next couple of slides. So as you can see, it's not a lot of money to live off of, especially in California. And so a lot of my clients work to supplement this, and they're still able to keep SSI and eventually Medi-Cal as well. Let's go to the next slide. And Medi-Cal is the healthcare program attached to SSI. If you qualify for SSI in California, you automatically qualify for California's healthcare program called Medi-Cal. Medi-Cal is a whole other octopus, and I'll introduce you to that octopus later in this presentation. Next slide, please. So how does work affect SSI benefits? Let's take a look at an example, because this is the easiest way to help you understand. So we're going to use this example of a person who has $1,300 in gross wages a month. So basically there is a $20 disregard, there is a $65 disregard. What that means is that Social Security is not going to count the first 20 or the first 65 of earnings. And even after that, they don't count the next half of a person's earnings. So what you have left is, out of that $1,300, Social Security will use at $607.50 in this example to determine the new SSI rate. So in this example, the person's base rate is $943.72, and it's going to be reduced by $607.50, and this is the new SSI rate. The new benefit amount is $336.22. Add that to the gross earnings. A person will always be better off working and on SSI than just on SSI, as you can see from this example. Next slide. So what facts does Social Security consider when looking at SSI eligibility in terms of these work rules? So here is a quick list of some other SSI work incentives. So there is a student earned income exclusion, and for SEIE, students under the age of 22, Social Security will actually exclude $1,900 a month in earnings. So a student may not see any changes in their SSI monthly payment because of this exclusion. A pass plan allows a person to save beyond that $2,000 resource limit we mentioned earlier, or to use a second source of income to help support an employment goal without reducing or affecting SSI eligibility. It's an application process, and we can assist people with getting pass plans, and we have done that, and we do that pretty regularly. They also look at IRWIs, the same as SSDI, or I'm sorry, Title II. They also look at IRWI expenses, and I'll show you a quick example. I think we're good on time, so I'll be able to show you an example of how they look at IRWIs. And similarly, for people who are blind, there are BWIs. They're much more broader, the blind work expenses, than the IRWIs. So when I'm working with someone who is blind, we have to consider BWIs as well, and we talk to them about their expenses. Next slide. So here is a calculation example similar to the one we just saw. And instead of, so you do the 20 disregard, the 65 disregard, and in this case, they will also disregard an impairment related work expense. It could be, maybe transportation, it could be service dog expenses. So in this case, IRWI is going to help this person not have as much reduced. So they'll have $386.22 in SSI. And so again, if you look at what their total monthly income is with their gross pay and their SSI, they will always be better off working and on SSI than just on SSI. All right, next slide. So what happens to Medi-Cal? So if you're on cash benefits, if you're on SSI still receiving cash benefits, you can go to the next slide. You'll continue to receive Medi-Cal. So here's my Medi-Cal octopus. And there are so many ways in California to keep Medi-Cal. With the Affordable Care Act, it really created a lot of Medi-Cal programs that allows us to keep Medi-Cal despite having earnings from work. And so, first of all, a person can continue to qualify for Medi-Cal if they're no longer on a cash benefit through something called 1619B. This allows someone to still keep SSI eligibility for purposes of Medi-Cal if they're not earning more than $37,994 a year, and that's this year's threshold. The 250% working disabled Medi-Cal program has an income limit of $62,472, and that's before deductions. So they don't count all income. So when it comes to Medi-Cal, this is the biggest piece and the biggest concern that people have. I want to go to work, but I don't want to lose my health care. And so this is a big piece of what we do is help people understand the transition that might happen to Medi-Cal. They may transition into 1619B. They may transition to the 250% working disabled program. Some of my Title II beneficiaries will be eligible for Medi-Cal for the first time because of the 250% working disabled Medi-Cal program. And so we make sure that people understand the transition, that they should look out for notices. They should call us when they get a notice that doesn't make any sense, and to definitely call us if there is a Medi-Cal termination notice, because sometimes the counties do make mistakes when it comes to transitioning people into one Medi-Cal program to another. All right, next slide. So there are different ways to get back on benefits if someone lost benefits due to work and earnings. One way is through expedited reinstatement. A person can request to have benefits started again if they're no longer working at that SGA level or they lost benefits due to earning too much. So this is just one way, is expedited reinstatement. The next slide. Okay. So what is WIPA? I haven't seen any questions, so I think I'm good on time. So WIPA is an acronym for Work Incentives Planning and Assistance. We are funded primarily by Social Security Administration, and we provide individualized, in-depth, employment-focused benefits counseling and work incentives planning in all 50 states and the U.S. territory. So we actually exist in every state. At the DRC WIPA, we serve Riverside, Imperial, and San Diego counties. When we look at WIPA benefits counseling, we take a look at a very holistic approach to benefits counseling. What is the benefits package that this person comes to us with? Are they on Social Security benefits? Are they on SSI benefits? Are they a veteran receiving benefits? Are they receiving any other type of benefit? Are they on CalFresh? Are they receiving any of the energy assistance program? So we really try to understand the benefits package to make sure that we can give the best counseling possible. And we will not do any of that until we verify benefits. So that's a big piece of what we do, is verify benefits. So we talk to the client about how we're going to verify benefits, work with them to determine what the best way is to verify benefits. Another thing that we do is that we identify and connect with services supports needed. We help the client identify and connect them with services supports they need to overcome barriers to employment. So sometimes people come to us and they just don't know where to start. It's the first call that they've made. And so are they getting help from Voc Rehab? Have they connected to the Workforce Center? So Workforce has never been a small secret to me. It's a resource that we've always referred people to make sure that they connect with. And ultimately, what we also do is help them understand how paid employment will affect all these benefits that they have. And to help them identify, use, and manage Social Security work incentives. Do they have an IRWI? All right. I had a client who had a service animal, and she had no idea. Actually, it was an emotional support animal, so we had to jump through a couple of hoops to make sure that that animal was going to be an IRWI. But she had no idea what she spent monthly. So during the trial work period for the first 3 to 4 months, we made sure that that she tracked her expenses so we can have a better idea of what it was going to look like for her after the trial work period, because she might be working over SGA and those ERWIs would bring her down to below that SGA level. And that's exactly what happened after I met with her and she collected some information. But in her case, she decided to work full time. They offered her more hours and she was doing great. And so that was a really great story because she was able to understand that she had these ERWIs. She knew she was going to be able to use them, but in the end, it worked out better for her to work full time. So next slide. Okay, so we also help clients make sure that they're reporting wage information. The Social Security has different ways to report wage information. And so we talk to that client, do they have a computer? Can they do it online? Right now with COVID, or do they want to call and start reporting wages? Do they want to mail? So there's different ways that people can report. And so we have to figure out with that client, what's the best way that they're going to be able to report wage information and what do they need to report. And essentially help beneficiaries to successfully manage benefits over time. I have clients that I've been working with for years and they're now reaching their 9th trial work period, or they just started a job, even though we started working with them in 2018 and even 2017, because maybe they were working with voc rehab, maybe they were, they had some issues they had to deal with before they really started working. And so, we make sure that they understand when the trial work period's gonna may be over so that they can connect with me if they haven't had any correspondence or communication with Social Security. Because normally when they're close to the 9th trial work period, they should have already have had a work review. So another thing we do, again, we analyze healthcare coverage options so the beneficiaries can determine which option offers the best coverage. I had a client who had a great job offer. He could have stayed on Medi-Cal, but it was actually going to be cheaper for him to take his employer insurance. And that was a really big leap for him. And so, we went back and forth, talked about it, and ultimately he made that decision that he was going to take the employer insurance. He didn't have to do that. But under for his particular situation, he would have had to have paid a premium that he could have saved every month rather than just taking the free employer healthcare coverage. And of course, we help resolve benefits problems. We had a client where we verified benefits and lo and behold, he's not on benefits. And there was a problem because he hadn't reported some information about his workers' comp case. So we made sure that he connected with someone to get that resolved so he can get back on benefits and keep moving forward with his employment goal. All right, so the message that we can all send and that I hope that I've been able to show you is that paid employment and Social Security disability benefits don't have to be mutually exclusive. It's actually possible to be on benefits and work, even full-time, and to keep Medicaid and or Medicare in almost every case. It is very rare to see someone lose Medicaid, Medi-Cal, or Medicare. But a lot of times what has to happen, if that's going to happen, people have to, with our services, they will get that information and they'll know when that transition happens. It's possible to work and come out ahead financially, even if benefits are reduced or ceased. And it's possible to get back on benefits, even if a person lost benefits due to employment. Next slide, please. Okay, so to reach WIPA, so again, Disability Rights California, I'm a part of a huge statewide organization, but I do this one piece of work, which is WIPA, and I serve San Diego, Riverside, and Puro counties, and here is our WIPA toll-free number. Disability Rights California has a legal helpline with a different toll-free number. This is specific to WIPA. If you're not familiar with the Ticket to Work helpline, the Ticket to Work helpline is also a great resource for clients because you'll get connected with an agent right away. The Ticket to Work helpline can help folks understand the ticket to work, provide resources, employment networks that provide employment services. And if that person needs benefits counseling, if the agent feels that this person really does need that one-on-one benefits counseling, they'll make a a referral to us. As a matter of fact, a majority of our referrals come through the Ticket to Work helpline. The website to the Ticket to Work helpline is also there. If you need to find a WIPA in a different county, you could either call the Ticket to Work helpline, or you can go through the Choose Work website, the Ticket to Work helpline, and there is a search engine there where you enter a zip code, indicate that you want to look for a WIPA, and you can find a WIPA in a different county. There are 7 WIPA projects that cover all of California. So, and of course, as I mentioned earlier, is that WIPA exists in all 50 states and U.S. territories. So with that, here is my contact information. If you want to refer clients or need more information, you can always give me a call. Here is the WIPA intake line, and my direct line, our fax number, and the California website if you're interested in learning more about Disability Rights California and all the robust services that we actually provide besides just WIPA.
All right. Well, thank you so much, Alida. I know I learned so much from both presentations. Again, we heard from Deputy Director Leslie Trainer with Workforce Services, and just now, Alida Taruno with disabilities of, oh my gosh, I lost it. Is it Disabilities of America? But nonetheless, lots of great information presented. We left some time available so that you can ask questions. Before jumping into that, I wanted to make sure to recognize our county IT, Riverside County IT department, who is on the line and has spent time with our team in preparation for today's meeting, but also is helping us facilitate the meeting as it's happening. So thank you to Angela, Julius, and others on your team that are supporting us today. With that, we will go ahead and open it up to hear from you. Hopefully this will work. Right, I know I went through the chat box and it looks like we answered any questions that were inserted there, but if you have a question at this time, feel free to unmute your mic and you can direct your question to whether it's Leslie or Alida.
Good afternoon. This question is for Leslie.
We can hear you, Brandy.
Okay. So Leslie, my question is, a part of our program, we do a match service, and workforce development has been a big part of that. So now that we're in COVID, the virtual meetings, will there be any way to have a career development specialist that could be just assigned to just my group of clients, or is it only for whoever attends the virtual meeting?
Which virtual meeting were you referring to, Brandy?
It's for the workforce development.
So what clients do you serve?
I serve for rapid rehousing. It is for families that are homeless, and then they come into our program, and we assist with identifying housing, rental subsidy, and also
Brandy,
employment. Mm-hmm.
I apologize, Brandy, you're with Lighthouse Social Services, correct?
Yes.
Okay.
Okay, thank you. So the way we handle that really just depends. If there are larger projects where in some cases we'll have an MOU and
okay.
we'll assign a single career coach as that point of contact.
Okay.
In other cases, there's more than one career coach. So it really just depends on the specific situation and our capacity at the time. But if you have a regular pipeline of customers who need our help at workforce development, What I would recommend is that if it's been a while, it sounds like you've used our services, but if it's been a while since you've sat down with our team and we've come up with a strategy for how to systematize the servicing those customers, it may be a good idea for us to plan on having that conversation offline, probably with you and me and Stephanie Adams, our operations manager.
Okay.
Would that be helpful?
Yes, and actually we do have an MOU with workforce development. So what I'm trying to do is I'm just trying to make a smooth transition for my clients. So then that way I don't have everyone spread out between different career coaches. And if I can just link to one, so that way we can provide the smooth transition as I was stating, then that would just make it easy for everyone involved.
Okay, it looks like Jamie has her hand up. Jamie, did you have something that was relevant to Brandy's comments?
No, I'm sorry. I was talking with my mic muted. I actually had a question for Alita in regards to WIPA contacts. Do you?
Jamie, I think Leslie's still finishing.
Oh,
I just saw your hand up and I didn't know. I know you work with the special programs team at housing, so I didn't know if you had your hand up for Brandy. But Brandy, I think I'd like to talk to you a little bit more offline. I put my email address in the chat box. Are you able to get that email address and shoot me an email so we can chat some more?
I'm not able to see it because it just has here on the screen just the coc@rivco.org on my screen, but I can get it later. That's fine.
Yeah, hi, this is Karen from Lighthouse. I can see it and I'll get it from Brandy. Thank you so much. Thanks,
Awesome.
Brandy, for that question. Yeah, that's great. And just to let you know, we have worked and we've had an agreement with workforce development, prior to this for a couple of years. So it's really been excellent for our clients, and Brandy, working with your team, has been able to get a lot of people employed. So we want to make sure that we're able to continue with that resource, even kind of in this COVID atmosphere that we're in, and kind of see how we might be able to be creative, with continuing to provide that service to our clients. So Brandy, I know you're on your phone, but I have the information, Leslie. Thanks so much, and we will get in contact with you. Appreciate it.
Okay.
We will find a way. We've been doing virtual career coaching, so I look forward to your email, ladies.
Great. Thank you.
Thank you. Jamie,
I'm now done. It's all yours.
No, it's okay. I'm sorry. I think I'm delayed because I was talking and you were talking. I actually wanted to ask Alita, as far as contact goes, I know you guys have a slide up with contact information for WIPA. Is there any specific contacts, like case managers contacting on behalf of the client, who they would need to direct their questions to? And secondly, I wasn't sure if it's been discussed. I don't remember hearing it, but do you guys offer any sort of advocacy programs for people who may have been denied benefits?
So the benefits, no. So we don't work with clients who are not on Social Security benefits. I have had those calls, so I usually try to find a referral for them and either connect them, depending on which county they are in, maybe the legal aid, or to a bar association or something called NASR, which is I don't want to remember what NASR stands for, but it's a attorneys who do Social Security work. And then I work with clients, so I have to work with the client if they want to work with us. We have to work with the client. But if the client's working with a case manager, which happens very regularly, then we'll work with them to make sure that we understand what information needs to go to the case manager, because we summarize everything that we've talked to the client about in writing. And so in some cases, the client's like, can you please just give it to my case manager? And that's perfectly fine. As long as the client can tell us that that's what they want, we can share the information that we provided to them, to the case manager, or even Voc Rehab. Sometimes the counselors the counselors ask the client, once, Aleda gives you information, can you share it with us? And so if the client is okay with it and they give us the okay, then we'll share it with whomever they want.
Got it. Thank you.
Mhm.
I know that you mentioned about not working with those who are not eligible or who don't have Social Security benefits. Have you ever been made aware of the HDAP program?
HTAP?
HDAP, it's Homeless Disability Advocacy Program. It's for people, because I know you said that people have been like denied benefits, and maybe those come up in your conversations. Have you ever received or heard of information regarding that program?
No, I mean, usually I refer them to the legal aids or a local organization, but I don't know specifically if I've referred them to Oh, you mean like with the county?
Yes.
Oh, okay. Yeah, no. So yeah, so that's why we connect them to the legal aid, at least in San Diego, but I wasn't aware that there was a program in Riverside County. So
Okay. I'll send you an email. Connect
that would
with.
be great. That would be
Okay.
awesome. Thank you, Jamie.
Sure.
Great questions. Thank you, Jamie. Thank you, Brandy and Karen. I know we still have other guests on the line. I want to make sure we utilize the special time we have with both speakers. Alida is actually with Disability Rights California. I stand corrected. I was giving her more control, and I tend to do that, right? Like I promote people. I said Disabilities of America, Disability Rights of California. Are there any other questions? If so, this is your time. Feel free to unmute yourself and direct your question to the appropriate speaker. All right, and if there are none, that's okay. I think both speakers did a wonderful job providing a full overview of the different services that they provide and answering questions that came up as they were speaking. So again, we just want to thank you for participating in today's webinar. Again, keep us in mind if you'd like to showcase the great work that your agency is doing for our November and December series. We have our next workshop coming up on September 24th. So keep an eye out for that flyer and information. You have our email address. Stay safe, stay healthy, guys, and please do not hesitate to reach out to us again if you need anything. Have a good one. Bye.
Bye.
Great presentation. Thank you.